My name is Christina Terrell, and my project is about music therapy and elderly stroke patients. A 76-year-old male is facing Erickson's eighth and final stage, which is called ego integrity versus despair. This occurs in a person's lifetime when they are 65 and older. In this stage, it is when a senior citizen thinks about their life and their accomplishments and their successes in life. To most senior citizens, their accomplishments are their children. If a senior citizen sees themselves as successful, they develop integrity. However, if they do not, they will begin to feel a loss of hope. The virtue that is gained from this psychological stage is wisdom. This plays a vital role with a 76-year-old male who had a stroke. He could begin to feel despair without being able to function the way he normally did due to his stroke. Definition of a stroke is that it is the most common form of brain damage. It is caused by decreased blood supply to a region of the brain. When neurons in the region are without a blood supply and deprived of the nutrients and oxygen for even a few minutes, they cease to function and die. This neuronal death, when it results from vascular disease, is called a stroke. The most common issues of a stroke are areas of movement, speech, language, perception, cognition, and emotion. Statistically, strokes account for 30% of annual total deaths worldwide. A stroke does not lead to individual symptoms or disorders, but a set of interrelated symptoms and a symptoms matrix. On the region, there are different effects of a stroke a person can have. If the stroke affects the right side of the brain, a person can have paralysis of the left side of the body, vision problems, quick inquisitive behavior style, and memory loss. If the stroke affects the left side of the brain, a person can have paralysis of the right side of the body, speech, language problems, slow, cautious behavior style, and also memory loss. Finally, if the stroke occurs on the brainstem itself, depending on the volume of the injury, it can leave a person in a locked-in state where they might not be able to speak or achieve any movement below the neck. According to the American Music Therapy Association, music therapy is an established health profession that uses music and the therapeutic relationship to adjust physical, psychological, cognitive, and or social functioning patients of all ages and disabilities. Because music therapy is a powerful and physically non-invasive medium, unique outcomes are possible when interventions are directed to reduce pain, anxiety, and depression. These outcomes appear to be mediated through the individual's emotional, cognitive, and interpersonal responses to the music and or the supportive music therapy relationship. There are 3 different types of music therapy, and the first one is receptive music therapy. This is where music listening occurs and the patient listens to music they choose. Second, there's improvisational music therapy, where the therapist improvises synchronized with the breathing timing, timbre, and rhythm of the patient. Lastly, there is recreative music therapy, where the patient can sing to familiar songs or do oral motor exercises, where the therapist plays a familiar song and exaggerates the mouth and tongue movements. The patient is asked to mirror the therapist's movements. All these therapies can improve patients' motor skills along with their emotions and cognitive skills. When it comes to music, researchers have found that rhythm can stimulate damaged areas of the brain that are otherwise unreachable. A doctor known as Michael Fout explored deeper aspects of the cerebellum. His team found an ancient reptilian area that was key to entertainment. When patients heard the rhythm, a subconscious effect occurred. The patients did not have to think. they naturally impulse to move to the beat. You might say that rhythm goes without thinking. Activity I decided to do was a simple one that you might find commonly used in other music therapy sessions. My activity is to have the 76-year-old senior male listen to an iPod. The items that are needed are an iPod, any generation, large headphones, a survey, and a volunteer or family member. There are a few purposes behind this activity. These are overall goals I would like to see the client reach after the activity that is possible through music therapy. The purpose is to reduce pain, regain memory loss, regain motor and development skills, and regain happiness and overall quality of life. To really do this activity, there needs to be a procedure. First, before distributing iPods, a volunteer or family member will ask the client what were some of his favorite years growing up and what his favorite music was. If he has memory loss due to the stroke, we will play music from the 1960s, which was an era my client was in his 20s and could bring back some memories for him. Next, the volunteer will then give the client the iPod and help him put on the headphones. Once it is on, we will play the bands that were popular when he was growing up. Then we will observe the client's reaction and let him enjoy the music and see if he is able to move the parts of his body that he is no longer able to move since his stroke. 30-minute session, we will then ask the client how he feels, and we will repeat this procedure on a daily basis and explore new music with him every day. Overall, the assessment for this exercise is that it can help a patient reconnect and relearn what they may have lost during their stroke. Music therapy is an effective way to get patients to help express themselves when they cannot express their feelings through talk therapy. By doing this exercise, a patient can begin to stimulate damaged areas of the brain. The treatment for this exercise is that when a patient has suffered a stroke, music therapy can heal better than medicine and help the brain recover. It can help a 76 senior male not only regain their memory, but also help him get back on his feet and gain the memory and motor skills he once lost.